Chronic injuries are a different story. These have often been in the works for a long time. In most cases, we're talking years. In some cases, decades. So basically what happens is over time, and maybe this started from an injury way back when, but nonetheless, there's always a movement component to these chronic injuries. That's just how it works. So there's something, whether it's a tight joint or tight joints, weakness, some kind of poor stability in certain parts of the body, and it may be a combination of all these things. But chronic issues tend to present a little bit differently than, say, post-op or post-surgery situations do. With these, we have to address all impairments and try to deal with them all at the same time, but understanding that they are typically movement-based. Now, you might have tightness in your calf muscles, and maybe your ankle joint doesn't move well. Maybe the IT band is locked up and needs to be addressed. Maybe there are some postural issues that we have to also address, but those things all need to be tackled at the same time. Oftentimes there's an order you want to do them in, and this all starts with proper assessment. But understand that you have to change not just what you do with your exercise, but your daily activities. The daily activities add up to a significant amount of volume. If you look at all the steps you take, the stairs you climb, the number of times you sit and stand, all these things will add up over the course of the day. So if you're doing exercises, 20 minutes, maybe an hour a day, or you're at the gym, but you don't address all those other daily activities, the exercise can't compete with that. They can't compete with the volume. You have to change how you move in general. And part of that starts with making you aware of how you're moving. And that's where a good assessment can point things out that maybe you didn't even realize you were doing. And then you start to pay attention to those things throughout the day. You start to make those changes. And then you reinforce it with your exercise program, and you allow those two things to work together. That's the key to not only managing the issue in the short term, but actually reaching a point of resolution in the long run.